next up is the Missouri program. And Tracy Klug is the manager of the newborn screening unit for the Missouri State program, and she's had 15 years experience, and I've worked closely with Tracy in the early years of implementing newborn screening for Krabbe disease, so she's going to provide an update for her state screening.
Thanks, Joe. And thanks to Hunter's Hope for the invitation to share Missouri's newborn screening updates today. Next slide, please. So we started screening for Krabbe disease in 2012, initially through the New York Newborn Screening Lab and Dr. Orsini. And then in 2015, we implemented an in-house fluorometric bench assay for Krabbe. We use ASRs that are purchased through the vendor Babies. And then we started reflex testing for cyclozine in 2020 as a send out to Mayo. And at that point, we saw a big drop in our false positives after screening, after we started that testing. So that has been a huge improvement for us. We've screened around 715,000 newborns to date. And we've detected 3 newborns who were diagnosed with infantile Krabbe disease, and then 2 with late onset Krabbe disease. So our program contracts with 3 genetic referral centers within the state who coordinate follow-up testing for babies with positive test results. And so the way we would inform the baby's parents of a positive test is the lab sends the abnormal results to the geneticist, and that's according to the family's county of residence. And we also send the results to the physician of record. And then typically after consulting with the geneticist, then the PCP will phone the baby's parents to discuss the result from there. Next slide, please. So our exciting news for the year is that we started full population pilot screening for XALD in December of 21. We're using LC-MSMS in negative ion mode for that first tier screening method, and we do not have a second tier test at this time. We've screened about 38,000 newborns to date, and we've detected actually now 2 ALD diagnosed babies. We do have a few other patients who were referred, but we're just waiting for final diagnosis on them. And our algorithm for informing the baby's parents of a positive test is a little bit different during the pilot phase because the ALD result isn't actually on our official lab report yet. So the lab sends the abnormal result only to the geneticist, and then the geneticist contacts the baby's physician who calls the parents from there. Next slide, please. And that's it for my update today. Thank you.